Hi everybody. Welcome to our webinar and quick session about refugees and their mental health for Time to Talk Day. So happy Time to Talk Day, everybody. And we are glad you joined us. So today, my name is Vlada. I work for West Sussex Mind as an outreach and development worker for Ukrainian community. And I have my colleagues AJ and Lydia today with me. So can you say hi to our listeners, AJ?
Hello, and thank you, Vlada, for the intro. My name is AJ or Anesta, and I am the Communities and Inclusion Manager at West Sussex Mind. And I manage a team of people who work with different groups in the community who are not necessarily from this country of birth. And I support the team to support those out there who need West Sussex Mind service.
Thank you. And Lydia, can you say a few words about yourself?
Yeah, hi, I'm Lydia, and I'm a mental health support worker, and I'm happy to work in because it's really beautiful organization. And so I work also with Sanctuary, and I work with refugees. So it's my double role in the Sussex Mind.
Thank you so much. So before we start today, I just wanted to make sure you all take care of your own well-being because we're going to talk about refugees. For some people, this topic may be triggering. So please make sure that you have somebody to talk to after listening to us. Please make sure you have your glass of water, a cup of tea. If you have a chance, make yourself as comfortable as possible. And also, if you need to talk, then reach us or somebody else and we'll be able and we'll be happy to help if we can. I think we can start now. So time to talk, refugees. And I just wanted to ask the first question about why we all are here and why we all actually work with refugees. Because for me, it was very easy. I am a Ukrainian refugee myself. And so when I came to the UK after the full-scale invasion, I wanted to do something to help my community and also to raise awareness because I've realized how important it is for people to understand who refugees are, what we are like, what we do. And so I'm very, very passionate about this topic. But what about you, Lydia?
Yeah, thank you. I'm also Ukrainian refugee, and I also psychotherapist. So I know it from both ways, how to be a refugee myself, and how it's difficult, but still important to take care about mental health in new environment, which seem to be safe, but it's not so easy yet to adopt here. So I also try to do my best to help other people to feel more comfortable and be more healthy mentally.
Yeah, AJ.
And for me, my mum and dad came to this country in the Windrush in the early 60s. So although they didn't come as refugees, the experience they had was sort of similar uncertainties of, what's going to happen. What they were promised to what they actually received when they came to the UK was very different, and the support was not necessarily there. And so they kind of felt like they were left alone. So kind of their experience and what they've talked about with me. But also I've worked in different charities, and I've worked in homelessness charities, working with people with multiple and complex needs. And many people I supported were people who were refugees or asylum seekers who were left because for A, B, or C reasons they weren't able to get back to their country, and unfortunately they were left homeless with no access to public funds, and seeing the impact that made on them, and actually you know, how lonely it is to be in this country and have no money or nothing that you can do. You can't even get a job really because you're not allowed to do that. So I kind of could see the effects of people being homeless or being refugees in this country and how it impacts their mental health.
Yeah. I think it's also like we all have different stories and we're all from different countries. Well, me and Lydia are from one country, right? But me, Lydia, and AJ, we both share different backgrounds. And also, Lydia, you work with refugees from different communities and from different countries. And so I just think it's so important when we talk about refugees not to label it as like refugee and like not to think that every community is the same and they all face the same battles, because actually our battles are different, and some of the things that we have to deal with are the same, but some of the things are completely different. And so it's important to, when we talk about refugees today, to understand which refugees we're talking about, because, for example, Ukrainian refugees would be in a different position, like historically, financially, politically, as other, for example, Syrian refugees, or Syrian refugees would be in a different position with like asylum seeker from, I don't know, from Rwanda, for example. So, if we talk about, if we have this like quick conversation, like introduction to refugees and their mental health conversation, which refugees we are talking about today. So from my perspective, from my side, I'm bringing like Ukrainian refugees. Lydia, which refugees do you work with in
Oh,
in
yeah,
Sanctuary?
in Sanctuary, I work with different refugees from different parts of the world. So they are from African countries, from Asian countries, from even from Central and South American countries. So they are very, very different.
Yeah, that's something that inspires me so much, like the how diverse the community, the refugee communities are. And can you tell a few things about why these, like why people are here, why are they in the UK? Because uh, I think usually if we think about refugees, it's just like either or war, right? And people
Mhm.
actually have many different reasons.
Yeah, I was surprised to know that war is not only in Ukraine. I'm not very good in political geography. It's a pity, but yeah. So now I know that there are wars in the world. So so different people come to the UK due to war in different parts of the world. But also they come because of some terrible regimes which treat them not as people but as slaves or political regimes. So they escape from political regimes, not to be killed, not to be to defend their families, at least their children. But some people have I don't know. These reasons are not so drastical as war, but still it's survival needs. They have no food to eat, and they or medication to help their parents. So they or to feed their children, food to feed their children. So they came. They are looking for some economical possibilities here to work and to help relatives in their country. And some women try to escape from their husbands, and they can't divorce in their countries. And even if they are in nearby countries, like yesterday was I saw a woman. She escaped to Botswana, which is a nearby country, and her husband found her there and brought her home, and she was beaten and treated very, very um, unwell. Yeah, so situation are really very with this family abuse or sexual abuse or whatever. So the reasons are really very different.
Yeah. It's when you say that people come here to because of some political regimes or because of some other reasons that don't allow them to have the human dignity and to live with dignity and to live a fulfilled life in their countries. It just makes me so sad because I realize that they come from that horror, right? And then they come here to the UK, and the system puts them in a position in those frames and borders, and they can't really feel well, they probably wouldn't be able to feel as free and have as much dignity as they want to. AJ, I can talk about it for ages because we have those conversations with Lydia, right? But for a person but also we have our refugee experience, so we have something to compare. For a person who's local and who kind of was born here, how would you what do you feel about the circumstances and about the conditions that refugees are here? And can we talk about mental health with people who really suffer with some basic needs?
I mean, it's yeah, and I'm reflecting on what you said, Lydia, and it's it's definitely confirming of my sort of my experience and of people who have come here as refugees that I've worked with or that I know in my personal life. And from that experience to come here to the UK or to get away and get to somewhere where they know that they can be. I mean, compared to what they've been experiencing, it's definitely a massive relief, at least initially. But then as time goes by and they're still in that position in the UK and they're kept in that same sort of box and they're the food is very different to what they're used to, and maybe they don't have the facilities where they live to make or to go and get that food also, or they're experiencing some mental health challenges or some trauma because of what's happened. So actually going out and about and being around others, especially in this initial stage where they've just come over, it's quite a challenge. So I think at first, yes, it's definitely thank goodness I've got away from that, but then the next challenge is living with being in the UK, living with the food available, living with, the flashbacks and mental health challenges that you take with you as you go through life. Living with being somewhere where you don't speak the language and, you people kind of, may not understand you or receive you well, or they might make a decision that, oh, you must be this, you must be a refugee, and maybe people not approaching you, so you don't feel like you're part of the community anyway because you feel like you're still boxed in. So it's really important that we are mindful of that as people who live in the UK in the communities, and that we're mindful of that, and that we don't subconsciously, I mean, we can't help our subconscious, can we? But just kind of be wary that actually we can still speak to all the people in the community. We can still include them in the community. One of the big things I've noticed from the work I've done supporting people who've got complex needs, or for better words, may have multiple disadvantages, is that I think people can become a bit woeful towards people who are refugees, or woeful to people, asylum seekers. But the one of the things that's going to help is that you bring positivity, you bring motivation, you bring hope. Because bringing woefulness to someone who's already feeling quite woeful is not, it's not what's it's not going to make things better for them. But I understand that it does pull the heartstrings. I completely understand that. And I know that people want to help. But I think just including people in the community, including them in activities, speaking to people as you would anyone in the community. And I think that's what really helps. And it's not any really big thing you need to do. It really isn't. It's just about including people and just talking to them, really. It's from my experience anyway.
Yeah, totally. And I so agree with you that this thing that you say that when you come here, then the first what you feel is going to be a relief, like, thank God I've escaped. But then from my experience, I started trying to integrate or understand how things work, like BRP, like everything, food, job. And it was hard, but I do realize how privileged I am because, well, first of all, Ukrainian refugees we receive so much more support than refugees who come under the regular refugee scheme. But even for me, it was very, and also I know I came here already knowing English, and also I don't have children. I'm alone, so I realize how privileged I am really. But also, if even for me it was hard, I just can't imagine how hard it must be for people who don't have all those privileges and who don't have all those possibilities. I think the first shock for me was when I came in contact with Brighton Refugee Radio, talking like about Ukrainian refugees and everything. And I knew that situation with that we as Ukrainians were given more support, but I didn't realize how drastic the difference is. And I had my experience in living on universal credit. I was under 25 at that time, so that was like 200 something, if I'm not mistaken. It was like 200 something pounds per month. And well, it was great. I had those money and I could buy myself food, but the level of life and the level of your basic needs is very different, and that influenced my mental health. And when I learned about the amounts that other refugees get, when I learned about their conditions, I was like, how can we talk about mental health really if people are in this position? So I'm not probably the most experienced person to talk about this, but for us, I think we don't always think about the conditions that refugees are in.
Mm.
And I think it's
Mhm.
very important to bring that to life and to understand that, because I also face those things that really they break my heart, like when I'm on the internet or talking to somebody, as somebody is saying they here to they came to have a good life, they were choosing benefits, which benefits they want to be, they were choosing the country.
Yeah.
So
Yeah. I mean, it's like what Lydia was saying, political regiment or, political wars. And it seems that, that is the theme, is that, they've been controlled because of the political wars and those at higher levels. And then they come to the UK. And again, it's a political, uh, uh, what support they get, how they get it, when they get it. It seems that people are being moved from different hotels to hotels, and they're in the hotel in a room, maybe sharing with someone else. They're given food and they don't have as much choice as to where or what food they're getting. And they're kind of they were completely disempowered in their country and you know, completely you know, forced to, you know, live in fear and danger. And so, you know, when they come over to somewhere that's safe, yeah, it's kind of they continue to be disempowered, you know, in different ways that are, you know, which is probably a bit more sort of their basic needs, such as food, such as where they live, such as, you know, what clothes they can get and such. So yeah, I think it doesn't end there when they come over to the UK. What, in your experience, Lydia, what, you know, what feedback are you seeing from refugees on their sort of living?
Yeah, absolutely agree with you because I also thought that when I would be in a safe country, so I will feel myself better and safer, and yeah, so everything will be better. But it wasn't so easy, and for these refugees who are asylum seekers and refugees in whom I work with Sanctuary, it's more dramatic because they can't choose food and their children usually don't are not used to eat this food. They are used to something other, and they have other needs. And parents who see their children that they don't eat and they can't give them anything else instead of this, because they have more or less like £10 per person for a week, so they can't buy another food for a child, even to give to school for school lunch. So children should eat what they are given, and children um, don't understand that they need to eat to be healthy. They just don't like, I don't like it, so I don't eat, and that's all. And then they became ill, and then these parents went to hospital, and it's also dramatic when you can't understand doctors in hospitals or nurse in emergency, yeah, because I was also lucky to come here and to understand English. And I was spent in hospital with my children several days with emergent situation. And I always thank God for my knowing and understanding what is going on, what I am asked, and I can tell what my child feels, and doctor can help my child. And it's very difficult when people don't have any choice. They have little choice to walk or not to walk, to go outside to the room or not to go outside, to learn English or not to learn English. It's not even a choice. They should, if they want to live here. But yeah, and this in psychological way, it's very difficult for a person to be healthy, mentally healthy, if a person has no responsibility for his own life. He can't control his own life. He's just dependent on anyone else. So that's also is a problem for refugees.
Totally. And also in terms of safety, I was not surprised, I was shocked and frustrated and sad when I learned about protests in front of the hotel in Chichester. So you come to this country to feel safe, and then you see those people who don't want you here protesting in front of your windows. And well, okay, you're an adult, you can cope with this, but how are you going to explain this to your child? Like, okay, honey, we've escaped wars and tortures, and we came here, but no, nobody wants us, and people think that we came for to get benefits, for example. And also, I just think that it's so heartbreaking, and it must be so emotionally exhausting. And all the situation with money, given like food, for me, it's kind of like it seems like we are being picky or something, but I'm not. I'm just trying to explain how it may feel for a child, really, because even for me, I have a chance to buy the food I like. It's still not my country's food. And at the beginning, I was like, well, it's a bit like similar, that's great. But you know what? Now I talk to my mom, and every time I talk to my mom, I'm like, can you please send me me some of your food? Can you please send me some of your food? And this is me, a grown-up 25 years woman with a job, with the ability to cook. He has the kitchen, the facilities, money, and everything. And for people who are in the hotels and who are eating what they are given, and who have like £10 a week or something and can't buy the products for the food they need, and for kids, especially for like somebody who's 7 years old or 10 years old, and food is a huge part of their identity. It's
Mm.
it's hard. It's just like it's I know it may seem weird, like, okay, you've escaped like the war, but you're here talking about food, but it's a big part of cultural shock and of cultural like differences and integration and everything. And
Mhm.
it makes so much influence on the mental health when we are in a new country. And all these cultural differences for me as a Ukrainian, I know what happens with my community. For example, small things, really little things. Ukrainians live with host families. And for example, well, Lydia, let's imagine that I give this to you. Do you want some, Lydia, do you want some tea?
Yes, please.
Oh, great. So
Okay.
you became British. You became British. You say yes, please. One of this was that if I give this to a regular Ukrainian person and in Ukrainian I ask if you want some tea, they would say yes or no. And that's it. And local people, like our Ukrainian hosts, then they come and say, oh my gosh, they're so rude. They don't say
Mm.
like please or thank you. And I know it does sound rude when we speak English, right? Because this is the cultural thing. You're supposed to say thank you and please. But in Ukrainian, it wouldn't be considered rude. We wouldn't think about it as rude. It's just like yes or no.
Mhm.
Also, all of this, like, how are you things, like the culture of small talk. I tell my colleagues, if you don't want to know how I am, and if you don't want to listen to me for like 10 minutes, don't ask me the question, how are you?
Mm.
Why do people ask the question, how are you, if you don't want to know the answer, really? But again,
Yes.
realizing how privileged I am and how, like, looking at things with open eyes, we share the religion, right? Christianity. We share the right in the end. Of course, it's not the reason why we're here and why we're given so much. But it's important to see it and to acknowledge it. We have our culture, but our culture is still kind of a bit similar to local culture, but we find it
It's still
difficult.
European,
It's
so
still
yeah.
European, but I can't imagine how it can be for somebody with completely different background, completely
Mm.
different culture, to be here and to see that local people expect you to become one of them.
Mm. Not straight away. That's not going to happen, is it?
Yeah.
You're not going to completely disassociate yourself from your culture and your identity to just fit in and know exactly what's going on straight away. It's not the way it goes. It takes time. And anyway, if you're not being made to feel like you're part of the community anyway, and people are isolating you, then well, you're not being motivated to conform to a level, are you? You're not being motivated to do that. So yeah, it's important for people to understand and give space for other people to be themselves and to understand that they're not going to conform and that they're not being rude or that they're not there to appease other people and make them feel comfortable about approaching them. That's not what they're going to be doing. They're trying to just think about day to day how they're going to deal with the next day and how they're going to try and manage their mental health or manage their basic needs. So yeah, it's important that people don't take offense but also don't feel like they these people should come here and we've got the power and they should do what we're doing straight away. That's not how it works at all. um
Yeah.
yeah, it's very important too, and yeah, it's very important to realize that stuff like paperwork and getting stuff done and getting to the places they need to and going through the processes, they need support from services like West Sussex Mines, like the Sanctuary, like other organisations in order to get to the places they need to go to. So, yeah, I think just being mindful of helping people out in the community by doing things like that really is really helpful.
Yeah, and seeing them as part of the community, even though we're all different. That's so important, and to talk about it. Lydia, do you have any experience uh, that you can share with us about refugees from other countries having this cultural shock, probably not knowing where to go, not being able to, not even knowing whom to ask to explain things? Anything that you can share on that topic with us?
Just in general, it's they usually don't know whom to ask. So they are lucky to talk to volunteers in Sanctuary because they don't know where to start. So they need bank account. When they come to bank, they are told that that they should have this proof of settlement. Yeah, and they have no because they live in the hotel. So that's but they can't work or even volunteer without having this bank account, or other things like applying for universal credit or applying anywhere for English courses. So it's totally so there are so many small details which they need to do, but they don't know where to start and whom to ask. And even they prefer to walk and not to use buses, because sometimes there were cases when they were told to to go in opposite direction. So when they asked for help, people showed them, maybe it was misunderstanding. And I also can't exclude this case because their English isn't perfect, so they maybe can't explain what they need, and people try to be helpful, but okay, but they went into in the wrong way. So it's really very difficult, not only because of not knowing language, but mostly because of that, but also because of these small details. I would say, as sociologist, I would say that when a person is growing in a special, in some definite culture, it's long process of socialization. It's not only family, but it's neighborhood, it's preschool, school. So it's a long process to taking this person into this society, into this community. And when the person, a grown-up person, comes from another culture, everybody supposes that, okay, he or she is grown up, she's rational, and she is cultural, so he or she needs to understand or to know all these things. So usually people even don't imagine that something can be so different. For example, as when people are invited to visit someone's house or home, yeah. So usually British people have separate toilets, like upstairs and downstairs. Downstairs are for guests and upstairs are for like masters, yeah. But children don't know this. They don't know this rule that you can't use this master's toilet. If there is toilet downstairs and it's closed, and the child know that there is toilet upstairs, why not to use it? It's not rude, it's rational, but it's not polite in for English. Such small cases, but they are still very important, and no one will explain you because it's like very basic rules, yeah. No
Mhm.
one will imagine that that someone don't know this. It will be treated like not politeness, yeah.
Yeah,
Mhm.
and these small things are so important, because then you leave the house and you use the wrong bathroom and somebody said that, and then you leave the house and you already have so much things on your plate, and your mind is like, and you're like, oh my gosh, I don't belong. you may feel lots of different things that will affect your mental health directly. And talking about kids, and about culture and, for example, banter or something. When I first came to the office, I wasn't a kid, right? But there was this like scene, like local people, just like my British colleagues, just I was like, what is this is weird. And then I learned what banter is. But I had my host, I had my colleagues who were happy and ready to talk to me and to explain, right? That this is not offensive. This is like these are the ways in which you can do it. These are the people who you kind of like can do it with. Also little things for kids, and they don't like at school, for example, how other kids navigate and communicate, and they don't know this because again a very different culture. And recently I had a conversation with a Ukrainian girl, like a child, and we talked about making friends here and integrating, and she was like, Lada, I'm so tired that it's always me who needs to make efforts to integrate. And it's always me who needs to adjust, who needs to get involved in their culture. And they don't even bother to learn how to pronounce my name correctly. So I am called this instead of my actual name. And I just think for us, we can talk a lot about like mental health, about basic needs, about everything, but we can talk a lot about including refugee into our community, but we can't really skip a very important part. If we want refugees to feel welcome, if we want them to have good mental health, then we have to have our own awareness of their countries and of what countries they're coming from, what the situation is, and we have to have that genuine interest and not just be like, okay, this is how it is in the UK. Even to be able to explain how it is in the UK, you need to be able to compare and to know how it is in people's countries. And we often miss this very important part about awareness, and we don't teach our well, I see some of my community, right? So when I say we, it's not that I just like blaming British people. No, there are lots of people. And even people in my community, I see we don't always, as Ukrainians, don't always teach our kids about some important stuff, about some awareness, about other cultures, other communities. And I just think it's extremely important for us to know and to be genuinely interested and to see people as people and don't
Yes.
put the pressure on them, like become one of ours, become one of us, but be like, oh, but who are you actually? I want to know who you are, and I want to be different with you, having different cultures, different backgrounds, and I want to be as invested in your culture as you are in my culture.
That would be good, wouldn't it? That would be an idealistic response to anyone who comes to this country, whether they be a refugee or not. Yeah, I think you're right. It is about a vice versa, relationship. It is about knowing about them and not just one way. And yeah, I feel for this girl, and I'm not surprised she's feeling exhausted because I mean, she's trying to just learn and go to school and just be, and then having to do that extra on top all day long. I think also it could be, when she's having to explain herself probably to the next person, they ask the same questions, which are quite ignorant questions, but it's natural ignorance. So, I mean, you want to respond and make sure you do that in a way that they can understand a bit better. But it is all exhausting, and I definitely know from my experience I was lucky enough to grow up in the UK and in a community which was multicultural and had people from, who were Chinese, Japanese, who were Bangladeshi, who were Indian, who were Pakistani, who were African, who were Jamaican, who were Polish, who were French, who were Spanish. So I had a lot of different people around me, and we would all talk about our cultures, and we would do that walk into school and from school. And so we all learned and grew up, just naturally as children, being able to ask those questions, but not in a way that was like, they put you on the spot or make you feel like you were completely by yourself. We just used to do it walking to and from school, so it was normal for us. But when my mum and dad came to this country, in the Windrush, my dad said that he'd walk down the road, and people who were white would cross the road, says he was walking down the road because he was black. And he didn't really notice, but eventually he did, and he was like, he just laughed because he thought it was really funny. He just thought, what are you doing? I don't know what you're doing. Like, he just got on with it. He came here to work as he was asked to in the Windrush, and to bring trade, and that's what he did. He came and he did that, and he worked really hard, and he just involved himself in the community of West Indian people who were here. So, I mean, people can't be surprised if people do end up sticking with their communities that who will come over, if they're going to receive such reception from other people, and going to be made to feel like they don't belong in a community for any reason whatsoever. So, yeah,
Yeah.
it's very interesting.
And while belonging, when we are talking about this belonging to the community, when I was preparing for this webinar, I really asked myself a question like, okay, Lada, you work with refugees. Yeah, okay, I'm a refugee myself. I work with Ukrainian refugees, right? And I have my local contacts, local friends, and everything. And I was like, okay, you talk a lot about integrating refugees in this culture, in this community. You talk a lot about how awareness is important. How many refugee friends do you have from other countries? And I realized that I don't. Well, I do have one person. There's just one person. How many people are there in this area? How many people are there in West Sussex? And that's just a rhetorical question, really, because most of us wouldn't really. And I think, and I start asking myself questions, but like, why was it like, why did I bother to go to the hotel, for example, and to ask if people need any help? Because they do need help. Why didn't I bother to go and follow? Why didn't I like really make a research? Maybe there is somebody there who needs a hand, who needs a friend, and who needs me. And why, if I talk so much about these like important issues and integrating and cultural awareness, yes, okay, go to different trainings, okay, listen to different things, but when it comes to practice, why does it happen that I don't have any refugee friends from, well, apart from my one? I'm sorry. I hope you don't you don't watch this and don't think that I don't care about you. I do. I just needed to make a powerful statement.
Mhm.
So yeah, just how important it is for us to go and try to offer help and try to become friends, because yeah, people are from different countries, and it's not always, you don't always have in your own life, we don't always think about, oh, maybe I need to have a friend from other country who's refugee, but the thing is, they need it. And if we don't give it to them, they will not be able to get that, because they're not going to come to us and be like, help us, be friends with us,
Yeah.
help our mental health. So it's our job to come to people and offer this help and talk about them and provide mental health support, talk about stigma and about everything. So yeah,
Can I add yeah, one thing? First of all, about France among refugees, our children are the best in this, because usually in school they are friends with those who are alike them, so they
Mm,
mostly they feel that somebody is more or less like me, and he understands me, so that's why they are supporting each other. They are really good in this. And other thing which I really need to tell is a great thank you to all British people for their volunteering and for their kind heart, because uh, really, I didn't expect such a kind support for me and my family from all these British people whom I met. And usually when I say sorry for my English, it isn't my native, though I try to speak, but still I'm not good in it. Everyone will tell me, oh, your English much better than my Ukrainian. And I feel like really I'm so bad because you don't know
true.
any Ukrainian, so I'm just a bit yeah. So it's very
Mm,
helpful, and it's very, supportive, and all these volunteers whom I see in Sanctuary and who really come to hotel and do for these refugees and asylum seekers a lot of things, and they are very heart opened, and they are befrienders. They are supporting them with transport or with excursions, or even they let them into their own kitchen and let them to prepare their food in their own kitchen. I know that kitchen is sacrifice place of sacrifice for every
mm,
woman, and to let another woman from another culture to do something other, which even maybe not tasty for you, for me, but it's so natural for them. So thank you very much for this support and kind heart. All thank you to all, yeah, British people. Thank you.
yeah, and thank you to all the other communities, like Lithuanian, Polish, other refugees who came here before us and who welcomed us and me personally. And I just really want to like spread this circle of kindness, this wave of kindness, and to
definitely,
talk about these important things. So I think it's
definitely.
the first quick thing about refugees that we as a team have done in this, like with Lydia, me, and TJ. I think hopefully in future we may do more. We have our Time to Talk podcast from last year about Ukrainian refugees. We're gonna have more awareness materials coming and work hard and do our best to help and provide support as West Sussex Mind for those who need it, and to provide translation and to just be there for people. And yeah, I also wanted to say a huge thank you to everybody, but I also wanted to make sure that we don't forget that there are different communities, not only Ukrainian, not only refugees in the hotels in Chichester, different organizations across
De-
different
definitely.
help.
And just before we go, I just wanted to say that a big thank to Sanctuary and other charity organisations that are providing drop-in hubs where people can get food, clothes, advice, get help with paperwork, get help with contacting family or being able to see their loved ones in a safe environment, that are getting mental health support from workers such as what Lydia's doing. Thank you to all of those services. If you can give anything to them, give your time, give spare clothes, give food, give money, please do so, because all of that really helps them. No matter where you are, there's probably going to be a charity organisation or maybe a local authority that's providing support to people who are refugees and asylum seekers. So if you want to give some help, and maybe you're not, maybe you're introverted and you wouldn't necessarily go to people and say hello and ask if they need anything. If you want to do something, those are things that would be gratefully received.
Thank you so much,
Thank
everybody. Mental health is not something separated from our real life. It's something that is life and that depends on all the other spheres of it. So let's support our mental health and those around us and support
Yes.
services who provide that help.
Support your community. Come on,
Support your
support your community. Support your
you.
community.
And great.
Build your community. Talk about your
Exciting.
communities. Guys, if you need somebody to talk about your communities and about refugees and everything, here we are. You can always find us and talk to us, and let's spread these conversations and keep them going for Time to Talk and make every day Time to Talk day. Thank you. And thank you, AJ. Thank you, Lydia.
Thank you.
Thank you. Bye-bye.
Bye-bye.